One of the questions that patients often ask is, can the weight in my breast come back after a breast reduction surgery? Answer to that question is to some degree. The reason I say that is because when we do a breast reduction surgery, we remove glandular tissue. However, breast is made up of gland and fatty tissue. And often as the breast matures, the glandular tissue, what's called involutes, and changes to fatty tissue. So all the breasts are typically made up of more fatty tissue. Therefore, if you put on weight down a track, that fatty tissue can increase in volume and mimic an increase in breast size. So I guess the answer in that situation that it is possible. So we very much ask our patients to invest in themselves, in their lifestyle, and to maintain a healthy weight to avoid that situation. The other situation to consider is if you've had a breast reduction and then fallen pregnant. As you know, breasts often enlarge in size during pregnancy and breastfeeding, and that can happen in this situation as well, which is one of the reasons why in most cases we advise to have this procedure once you've completed your family. The only exception is where we see cases of juvenile gigantomastia, which is young ladies who develop very early with very large breasts, and it has a very significant impact on their life, not just physically, but emotionally, psychosocially, and socially. And in those cases, it's beneficial to address it early, despite the risk of some recurrence. But we know the recurrence is going to be less than what they would have had if they didn't have a breast reduction.